Ecological Treatment for Parkinson's Disease by Dr. RG Maldonado, neurologist. Ecology defends nature from the ravages of man, and this ecological treatment aims to protect patients from over-medication, but it will have to be taken late and at a lower dose. This is the famous 1817 book in which Dr. Parkinson describes the symptoms of the disease, but it turns out that many of our patients now have different symptoms, which the famous English doctor could never see. Indeed, within 4 or 5 years of diagnosis, many treated patients will have two types of symptoms: those of the disease described by James Parkinson and others that he never saw. Those caused by modern drugs at high doses over months and years. James Parkinson never saw dyskinesias because he did not have levodopa. His patients did not hallucinate or lose impulse control. Nor did their nightmares increase because no one was selling dopamine agonists. Levodopa was the major breakthrough, and the drugs are indispensable, but their use should be delayed, and they should be given in low doses. Because, as Grayson said, remedies often make illnesses worse, and nature should be left to its own devices. The wise doctor must know as much about prescribing as not prescribing, and sometimes the best art consists in not applying a remedy. In the pharmacy, there are no treatments for Parkinson's disease, only for the symptoms. Drugs do not improve the course of the disease, and their side effects accumulate over time. Fortunately, there are treatments that do improve the course of Parkinson's disease, but they are not drugs. Don't look to the pharmacy for what life offers outside: exercise, pleasure, sensory diet, avoiding stress. Taking care of your microbiota and changing your lifestyle will improve you so much that you will be able to delay the use of medication. And when you need levodopa, you can start with the natural one, the one in the Mucuna, that tropical bean, which will allow you to reduce the doses of Sinemet or Matapar. There is a very special treatment for Parkinson's, the number one, and it is not in the pharmacy. It is outdoor exercise that is our dopamine factory. Any exercise is good, but the one that increases dopamine the most is the fast walk. Rajoy's walk when he was president and did sport. It consists of walking as if accelerating, as if you were going to miss the bus, and braking a lot. The diet of the senses is more important than the diet of food. Stomachs feed on potatoes or meat, but the brain feeds on colors, smells, tastes, caresses, and sounds. Without sensations, the brain atrophies. It dwindles. The sea or a massage are feasts for the senses. The other great source of dopamine is pleasure. If you win the lottery, if your football team wins, if you are in love or enjoying a beer at the beach bar, your dopamine levels rise. Yes, pleasure improves the brain more than crosswords. When we seek pleasure, the brain discharges a lot of natural dopamine. The day a patient enjoys himself, he needs less meditation. Stress kills neurons, and although some doctors will not admit it, stress causes Parkinson's and worsens symptoms. Ask the patient or their relatives how they shake or block with tantrums. I was convinced by Dr. Lee's videos of how prisoners of war walk and tremble. If you tell me your dreams, I can prophesy how your Parkinson's disease is going. Sleep and dreams are very important. Sleeping badly, having nightmares, screaming, or dreaming of strange animals are bad omens, and they get better by reducing medication. If your neurologist doesn't ask you what you eat and how you feel, change doctors. Parkinson's disease starts in the gut. That's where it enters and spreads. As digestion goes, symptoms improve or worsen, and patients know that. The microbiota must be cared for with prebiotics and probiotics such as yogurt and kefir. Mucuna is the best natural product against Parkinson's disease. Even the most skeptical doctor will recognize that common fava beans contain natural levodopa. Guggenheim discovered levodopa after a bean binge. Mucuna is a tropical bean that has the most concentrated levodopa. Any analysis proves it. When levodopa is needed, the natural form of levodopa in Mucuna can be used to start with under medical supervision. In some, but not all, patients already on medication, the natural levodopa in Mucuna could replace some of the conventional levodopa in Sinemet or Matapar, but always under medical supervision, because dose adjustments are complicated and there are risks. Mucuna alone has a weak effect. which is why it is sold over the counter, but with carbidopa, it is very potent. This is useful if you know how to dose, but error can lead to overdose and should never be done by the patient on their own. No vitamin or nutrient has been shown to improve Parkinson's disease, but when they are lacking, the progression deteriorates, so it is necessary to compensate with supplements. Many are described in well-documented publications, and in the book I describe the ones I consider most necessary. There is no Parkinson's disease in the jungle. It is not suffered by animals or wild people. It has developed in our society. Of course, there are genes that predispose to Parkinson's, but that genome develops in an environment. A civilized milieu that has moved away from nature with its toxins, social norms, technology. Culture against nature. Reason, like a charioteer, holds back the horses of desire and passion. Civilization has many advantages, but it is dangerous to suppress emotions, especially in Parkinson's disease. For the ecological treatment of Parkinson's disease, it is necessary to move away from the pharmacy and get closer to nature to recover the strength of instinct, which is the sap of the brain. We get sick as we live, and vice versa. We can regain our health by changing our lifestyle. Parkinsonians who achieve this will live longer and be much happier. The concepts and data in this book are based on 264 bibliographic citations from the best scientific publications. Also, of course, on my personal experience after 20 years, more than 20 years, listening carefully to Parkinsonian patients and learning from them. Thanks to all of them.